Today I'm going to talk about atrial septal defect. It is a birth defect of the heart in which there is a hole in the wall that is dividing the left atrium and the right atrium. The hole can vary in size and may close on its own or may require surgery. It is a type of congenital heart defect that is acyanotic, which means that baby usually won't present with cyanosis. So they usually won't have any bluish discoloration of the skin. And this atrial septal defect, there is left to right shunt of the blood from the left atrium into the right atrium. So in normal heart, the left side of the heart only pumps blood to the body and the right side of the heart only pumps blood to the lungs. So if the child has atrial septal defect, the blood is able to travel across the hole from the left atrium to the right atrium and then flow into the lung arteries. If this atrial septal defect, ASD, is large, then there is a lot of extra blood being pumped into the lung arteries. And when this happens throughout a long time, it makes the heart and lungs work harder in order to pump blood into the whole body. And this might cause the lung arteries to be gradually damaged. So for clinical features of ASD, most children are asymptomatic where there are no symptoms. Some might present with recurrent chest infections, heart failure, and also if they proceed into adult, they might have arrhythmia. For physical examination, we might be able to detect fixed split S2, ejection systolic murmur at the left upper sternal edge, loud P2, and also atrial enlargement causing chest deformity like Harrison grooves, as we can see in this picture over here. The black circle is showing the Harrison groove. For investigation, we can do chest x-ray, expect to see cardiomegaly, especially in heart failure. For ECG, we might see right axis deviation, prolonged QRS interval, and also sometimes there are signs of right ventricular hypertrophy. We can also do echocardiography to check the hemodynamic measurements and also to assess the size of the ASD. For treatment, we can do closure of the heart defect through surgical or transcatheter method. So closure is usually done at 4th to 5th year of life, and if there are symptoms, we do it earlier. If the ASD is large, it can be closed with an open heart surgery or by doing cardiac catheterization using a device inserted into the opening to plug the hole. So the main aim is to close the hole, close the defect, to prevent the blood flow from the left atrium to the right atrium. So that's all for my presentation. Thank you.